The beauty scientists, Dr. Kristy Hamilton and Dr. Kim. Real beauty without the hype.
What is a breast lift as opposed to a breast augmentation?
Great question. And so one of the key factors we want to decide when you're sitting down and discussing aesthetic breast surgery, what are your goals? If an increase in volume is one of them, then you can still have the breast lift to restore the shape, but you're going to have to consider other additional surgeries at the same time, other components of the surgery, like adding an implant or fat transfer. A lift alone is going to, not only is it not going to add any volume, but I tell patients that many of them will feel like they need to go about half a cup size down in their bras, not because breast tissue was removed, but just because everything is origami together so that it's higher, tighter, and more compact. So if that doesn't sound appealing, then you need to consider adding a small implant or fat.
And yes, underneath the surface, we can reposition breast tissue. And I always tell patients it's important to realize we can do things to the breast tissue, but technically with breast lift, we're really not removing breast tissue. We are repositioning it and we're removing loose breast skin and tightening it up. I think that's very important for patients out there to know in terms of pathology of the breast tissue, breast cancer surveillance, and all those good things. What do you tell patients?
I tell patients that if they are over 35 or older, I like them to get a preoperative mammogram for screening purposes, but that it's not going to change their risk either way of getting breast cancer in the future. Occasionally we catch some early cancers with that preoperative mammogram. So if anything, considering a left may actually catch something in advance, but that's not the reason to have surgery, of course. And again, I tell patients to think about it as like an origami of their breast, right? So we're working exactly with the tissues that they already have, but we're rearranging them for a more aesthetic, ultimate look. And that's what's going to change, and specifically the position of the nipple on the breast. So we make the areola smaller. Oftentimes after the breast getting larger and smaller, the areolas have expanded to a size that's larger than they originally were. So we make them shrink down to size. I like to do about 38 millimeters or so across, just depending on the proportions of the patient. And then we position them exactly in the center of the breast. And at first, I tell patients afterwards, you're going to look like you've got small implants. We make everything so high and tight that there's a lot of fullness at the top of the breast and the top of the chest, but it will ultimately come down to a natural teardrop shape. So if that's the aesthetic that you're looking for, a very natural look, great. If you like that more cleavage look, then again, we're probably looking at getting a lift as well as an implant to get that look. So I think that's an important distinction, that kind of convex upper pull of the breast versus that teardrop, slightly concave look. That's what you're going to get with a breast lift.
I often tell my patients, look, if you feel in terms of volume, your breasts are a little too big, breast lift is a great operation because you're going to lose some of that fullness. You're going to have a more aesthetically pleasing breast, and you probably don't need an implant. However, the patients where they want a certain shape, they don't like the slope at the upper pole of the breast. If they already feel they're a touch too small and they want to go even bigger in terms of volume, then, I mean, you need, some type of implant technology, whether it's fat or implant, to actually get you those long-term results.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.